let's talk about optimizing your testosterone. So what does optimizing your testosterone mean? Well, that means getting you to a certain level, about 900 to 1100 usually, and keeping you there for several months, maybe up to 6 months, okay? And so you don't have these ups and downs, ups and downs. We can only achieve this with pellets. What is a pellet? So a pellet is a bioidentical testosterone pellet about the size of a large grain of rice. We make a small incision in the glute. When I mean small, I mean like that little white of my fingernail, about that small, okay? And we insert these little rice grains, they're pellets, testosterone pellets, and what happens is your body will start building blood vessels around it after maybe 4 or 5 days. When it does so, it's not going to be released with time. Well, it is going to be time released, but not really time released. It's going to be based on your cardiac output. So the more you exercise, you're going to get more testosterone being released into your system, ready to use in real time. If you're making a speech, you got to get all amped up. If you're making a video, you got to get amped up. Your testosterone will go up like it would naturally. If you're having intercourse, it'll go up. If you're lifting weights, it'll go up. If you're in a stressful situation, you need that little extra boost. The cardiac output goes up. Guess what's also going to be released? Free testosterone, ready to use. This is about as natural as you can get. You get to a level, 900 to 1100, ideally, it's what we try to aim for, and you pretty much stay there for almost 6 months, and you start tapering down slowly. Okay, what's the difference between injectables? Because you know those are readily available. There's a low T center at every corner. But what are they really doing? Are they optimizing your health? Are they optimizing your testosterone? Absolutely not. They are not optimizing your testosterone. You're going to have these ups and downs. You're going to have to give yourself 52 to 104 injections a year. That in itself sounds awful to me. I personally do not like needles. Just not my thing. I don't like to inflict pain on myself unnecessarily, especially if there's not enough benefit for that. You know, you have to kind of weigh everything out, right? So what are the benefits of using injectables? Well, you definitely do feel better for about 3 or 4 days, and then you feel like crap because your testosterone goes whoop, and it goes whoop, and you're going to feel awful. So by day 4, most people are jonesing for it. That's why some clinics do recommend you do twice a week, which is still going to be not as bad, but you're still going to have these ups and downs, okay? A lot of injections. So it's not as much of a roller coaster. It's more of a hilly ride. Well, it's acceptable, I think, right? It's better than this. It's not as good as this with the pellets, but it's definitely more acceptable. So why not just do that? Hey, I can sacrifice a little bit. Okay, well, here's the problem. They increase platelet stickiness. They increase red blood cell production. What does that mean? What does that do? Well, platelets are responsible for clotting. And having too many red blood cells makes your blood sludgy. When your blood gets sludgy, it's more prone to clots. Ooh, you see what we're talking about here? We're talking about potential blood clot. We're talking about potential heart attack, stroke, or a DVT, deep vein thrombosis. You get a clot in your leg, lower leg, your thigh, and it travels its way into the lungs, causes a pulmonary embolism, which means the blood clot has traveled to your lungs. Not something I would be interested in, okay? I strongly advise you not to be interested in that. So, does this happen with bioidentical hormone replacement therapy with testosterone pellets? No, it does not increase platelet stickiness. It does increase red blood cell production, but not nearly as much as it does with injectables. So right away, we have this significant in safety and efficacy. So efficacy meaning like how effective it is. It's more effective. It's more safer. So right then and there, I mean, hands down, pellets for the win, right? If you do some independent research, you go online, you know, if you want, we'll leave some articles down here as well for you guys. But you're going to see that men feel much better on pellets. They usually do not feel that much better on any other form of testosterone replacement therapy. In many studies, especially with the topicals, it's almost the same as the placebo, meaning people who got a gel that had nothing on it versus people who actually got the gel with testosterone on it. They really don't feel that much better. So with pellets, if you're in your 40s, you're going to feel like you're in your 20s. If you're in your 50s, you're going to feel like you're in your 30s. Your drive goes up, your energy goes up, your mood is improved, your libido is improved, your stamina is there, your sleep is better, your muscle gains are better, your fat losses are better. Those are just the short-term gains. What are your long-term gains? Well, for me, it's all about the long-term play. For me, long-term health is true wealth. So it helps your cardiovascular health. It helps your lipid profile. It's going to help lower your bad cholesterol and increase your good cholesterol. It will also be neuroprotective. It's going to keep you sharper here. It's going to prevent Alzheimer's. It's going to help your bones. So gentlemen, make the call. Let's get you optimized. We'll talk to you soon.